So hello, I'm Bill Reiner. I'm the old man of the group, the old person of the group. But we're going to have a question and answer session for the audience. These are all patients. They've all lived through, well, they've lived through everything. They're still alive. So they're doing okay. I can say, I started out as a child. And in the meantime, I grew up and they actually have had the same experience. I'm a retired, I was a retired pediatric urologist first, and then I became a retired child and adolescent psychiatrist. And I kind of spent most of my career working in and around kids with bladder exstrophy and other major anomalies. So I went from urology dealing with kids with exstrophy to child psychiatry dealing with kids from exstrophy. These guys are all too old for me, so I don't know what to do with them. But why don't we have each of them just briefly introduce themselves and maybe tell you just a little bit about where they're from, and then we can start with questions from the audience.
Hi, how's it going? My name's Alex Lavirtue. I'm currently living in Clifton Park, New York, and I was born with bladder exstrophy. And I've gotten most of my care through Boston Children's Hospital, through Dr. Reddick and Dr. Bohr.
My name is Faith Niebuhr. I'm 23, also from Clifton Park. We both live together. I also went to Boston Children's and received most of my care from Dr. Bohr and Dr. Reddick.
Hi, my name's Eric Ryan. I'm from Arlington, Mass. I received most of my care from Dr. Hendrick. I'm 45 years old, so definitely the old one, I think, in this group.
Not by much. But.
Hi, everyone. I'm Lilia Dean. I'm from Chelmsford, Mass, so not too far away. I've always received my care from Dr. Joseph Bohr at Boston Children's.
What's going on, guys? I'm Zach, 32, live in Somerville, born in Seattle, but did most of my care in Children's Hospital from Reddick's and then Bohr as well.
Hello, my name is Erin Mello. I'm 44. I am currently in Fall River, Massachusetts, and I am also a children's patient. I was mostly Dr. Reddick, and then when he retired, I did Dr. Bohr.
So there's the panel, pretty scary group. So wait for your questions. I'd like to just make one comment before we start. We had a very good session on, actually more than one in essence, alluding to the risk of emergencies with bladder exstrophy. And I think a key thing that I'd like to point out, and that you need to tell your adolescents in particular, but also tell your younger kids as they start to grow up, that they may be off having that ski trip or being off with their friends or gone for the weekend, and they may be by themselves going off to an emergency room for whatever reason. And mom and dad may not be there, and they're probably not going to have their emergency kit with them. So they need to advocate for themselves, because I'd be a little stronger than what Pam Artigas said. She was very nice. She said many of the emergency room doctors won't have heard of exstrophy. I would say that most of them won't even have a clue. And the problem with physicians is we have a bad tendency as physicians to kind of know everything and not want patients to know that we don't know. So it's very important to teach your adolescents to advocate for themselves, and they have to have the courage to say, look, I know what I have, I know what I've had done, which means they have to know what they've had done, and you don't. It's very straightforward, because otherwise they can get into real trouble really fast. Okay, now let's go ahead with some questions. Well, don't everybody jump at once. Let me ask a question then to start with. So what were the experiences that each of you had in telling your friends? When's the first time you told a friend, and how did that go?
Yeah, that's a good question. So for me, I wasn't super open about my condition through most of my, pretty much up until I got into college. I kept it from most people just because I didn't want to be looked at differently. One thing specifically that always comes to mind is I played lacrosse in high school, and I didn't want to be looked at differently or as a weaker link on the team or anything like that. So that was kind of one reason why I didn't want to. And I was also just shy of, being looked at differently from my peers and middle school and things like that. So I was one of those kids that, went to the nurse's room to go get my medicine a bunch of times. So it worked out really well for me, but I started opening up towards meeting more people. Actually, after I went to youth rally a lot, because that opened up a lot of experiences to me about being comfortable with sharing like with everybody. So I started kind of sharing after it, like in college.
I think for me, I never really had an issue telling anyone. I've always just been pretty open about it. I don't think I really told like every detail. I kind of just was like, oh, like I was born in my bladder outside of my body. Like, but everyone thought it was kind of cool. But it kind of also gave me an excuse where it's like, oh, like if I have to pee, like I'm gonna go ahead of you kind of thing. So yeah, it's never really been an issue. And I don't know, I like teaching people about it too. If they ask me questions, like even this past week when I was working, I work as a pediatric nurse, and I was telling one of the doctors that I was working with about like this conference I'm going to, and he's like, oh, like what's it about? And I'm telling him that. I'm like, do you know what it is? He's like, oh, not really. Like, so I'm like teaching a little bit about it. So it's definitely cool. I never had an issue. I just kind of spare some of the medical details from people. So
And I always picked and choose who knew. Like my close friends when I was little kind of knew. They understood like when I had to go to the bathroom, I had to go to the bathroom. I also learned how to self-catheterize at a very young age. I think I was about 5 when I learned how to do it. So oftentimes it'd fall out of my pocket if I was like roughhousing with the guys or, doing something outside. And it would just come up in conversation. But I don't think I was ever shy about it. If someone asked me about it, I would explain it, but I definitely did not broadcast what I have.
Yeah, so for me, I was in a little bit of a different boat. I think the big thing here is everybody's going to have a different experience of how many people they're going to tell. For me, I never told my friends. My family knows and important close people to me know, but for me, it wasn't something I felt I wanted to share. And I think it's not a secret. It's not part of my identity I wanted to share to my friends. And I think that really, for some people, it's very helpful. I hope that wasn't me. Sorry if I broke something. Okay, hopefully it still works. But yeah, I just think that it's important for everybody to decide who you want to tell. Be careful with who you tell, but also don't feel like it's such a big thing that it's a big deal. If you want to tell people, it's really up to what you're comfortable with and what makes your life easier and happier.
Yeah, for me, I was kind of similar to Alex. Just kind of wanted to, bury it. Just wanted to go away, honestly. But then I got older and, couldn't really avoid it anymore. Told my closest friend when I was like 29. Obviously, my wife knew, before that. But honestly, it came after I went to the bar and came back in a peed his couch twice. And he's like, dude, what's going on? And I was like, well, I might as well tell you now. And it really wasn't that big a deal after I told him. Because he's like, that's why you go to the bathroom 100 times on a road trip. And like everything kind of made sense after that. So it really wasn't a big deal. But I certainly, like everyone else has kind of said, like pick and choose who you tell, like make sure that who you are telling, like they'll keep that a secret if you wanted to, or like they'll tell, who you would feel comfortable with telling. Because otherwise it kind of gets out and then it kind of snowballs from there. So certainly be like aware of who you're telling if you want to tell people, but make sure that like the person you're telling is like a comfortable person to tell.
I could just stand here now and go ditto, but I won't. I told my high school best friend. That's the first time I actually did it, because in childhood, if I was going somewhere, my mom would tell their parents, basically. I did not choose to do it. I didn't want it to make, I already felt different on the inside. I didn't want to feel different and feel like people were staring at me and, oh, it's because she has this, and she's different. And so that's pretty much when I finally blossomed and said, you know what, I don't care. This is me. So, but that's pretty much.
So a lot of different experiences, but the word different you use is interesting because that's a word that I've encountered hundreds and hundreds of times with the kids basically saying they feel, in fact, some of the kids go around, they feel like they have did I do that right? Is that backwards? I don't know. A D on their forehead, a scarlet D for being different. So it's one of the things that I would deal with kids in adolescence is this sense of differentness. And I think it's interesting you brought it up as well. But all your experiences have been different, actually. You've each had your own way of approaching it.
And I just wanted to add one more thing too. Just one thing I heard was that we didn't share necessarily, and I agree with this portion, is that it wasn't my identity. I didn't really feel like I needed to broadcast it because I didn't really feel like it was that important to tell. But if somebody were to ask, then I would probably tell them. But I like that part where I don't feel like it's part of my identity where I feel like I have to tell people about it.
That's a funny thing. You're a real life person.
And I just wanted to add one other thing on the different idea, especially for parents that are kind of navigating if they're going to be telling their kids' friends. Yes, bladder exstrophy is very rare, but you have to remember all the other different diagnoses that kids can have. I mean, each parent, their kid is probably going to have something. So they probably statistically are not going to have bladder exstrophy. I think our cohort of age 23 has a really statistically interesting number of bladder exstrophy patients, but at the end of the day, every parent is going to have to deal with something with their kid. So it's probably not bladder exstrophy, but it's something. So don't let it navigate your whole life and worry about how that's going to affect things. Everybody has skeletons in their closet. For
Right.
lack of better terms.
That's a very good point, actually. So the questions from the audience. Wait, there's a microphone going around. It'll come back to you in a minute.
Hi there. Thanks for doing the panel. We were just speaking about how it's been really helpful to hear about strategies to adapt to the school setting and college. But could you speak to how you manage it in your careers and at work, the accommodations that you need or access to the restroom and privacy and that kind of thing?
Yeah, that's a good question. For me, I kind of, the way that I've managed it is, pretty much the same. And what I was saying before of, I don't feel like I need to broadcast it. So I've been pretty lucky and, I have a Mitrofanoff and I do intermittent cathing. So for me, it's going to work. I work for New York State and I have an office job. So, I have easy access to the bathroom and stuff like that. And I've been pretty lucky too, because I know some people have a hard time with like the public restroom setting, but we have like private single bathrooms there. That has been really nice for me to have. The biggest thing though for me is, and I heard it before, is having like multiple catheters. I think that's been something that I've had to work on before. Is you just bring one and you end up having to reuse or something like that. Which in some situations in a pinch, it's not the end of the world if you irrigate and stuff like that. But I try to err on the caution of that and bring enough supplies. So being able to bring like a bag or having a backpack that maybe has like a zipper pocket or something like that, where, your stuff is going to be secure. That was always like an important aspect for me, at least.
For me, I think I'm very lucky. I don't have to cath and I'm pretty much continent for the most part. I do wear pads occasionally, sometimes for comfort, but I do leak a little bit when I'm exercising, usually running. So with my job working, I'm usually like on my feet all day. I'll carry a pad with me. And that's the part that people don't know about is the incontinence. But I never really have an issue with it and I'm able to just put it in my pocket and no one really questions it. So I'm thankful that I don't really have like people questioning me about that.
So for me, up until about a year ago, I was able to self-cath. Unfortunately, my urethra is strictured, so now I have a suprapubic tube in my stomach. But during the time when I was able to self-cath, so right now I work for Wentworth Institute of Technology. I'm a major gift officer, so I travel quite a bit for the school. But I have my own office. So what I would do when I had catheters is I always make sure I have at least 5 or 6 in the bottom drawer tucked away. And that was never an issue. No one went through my office, no one went through my drawers, but just in case I had them kind of tucked away. And I always made sure I had a catheter on me. And I would always do this thing before I left the house, like catheter cache keys. And like, honestly, I still remember it, but like, it was just, and I would like touch my wallet, touch my back pocket, like, and I was like, all right, I'm ready to rock. And, so it was just like always one of those things. And I remember even traveling. Like, again, I traveled quite a bit back and forth to the West Coast. And I would always make sure I had 2 or 3, rolled up in my pocket, usually elastic around. And I think I heard someone say how difficult it is to stay clean and hygienic, in public restrooms. Try it on a plane is even worse. I'd always make sure I had alcohol wipes and I'd wipe the tips of my fingers the best I could before inserting the catheter. And I found that did actually work.
So for me, I also don't cath, and I currently don't wear pads, but I remember wearing them in high school. And one of the big things I want to mention, especially for girls with bladder exstrophy, especially when you get to the high school age, no one's going to question you if you have a pad. That's kind of the nice thing that I think is nice to think about too, if you're worried, especially when you get to that age where you're thinking more, what are people seeing? You have to be kind of more strategic in your mind. It's kind of a nice safety net to think that no one's going to question or think twice if they see you have a pad.
Yeah, I don't cath either. But like knowing that, I just am one who goes to the bathroom a lot, especially if I have a large iced coffee and then suck down 2 water bottles, like maybe, take it easy on the beverages because you're going to be going in and out of the bathroom, every 5 minutes. So just going to be mindful of like how you react to like liquids and how often you go to the bathroom, things like that. But also I work from home now, so that doesn't come up as often.
I am a teacher, but luckily in my situation, I am a separate sped teacher, so I have TAs and stuff, so I am at least able to leave the classroom a lot more than a regular teacher. God bless you if you are, because you have to go so much longer if you have to go, because I do cath multiple times a day, but I also am in a situation where I was okay with telling my TAs about it, because if something happens where I'm like, oh my God, I gotta go, I don't want them to think like, okay, she's just leaving the classroom. So like, I kind of gave them a heads up, like, hey, listen, sometimes I might just do something and be like, I'm going to leave. So having that relationship possibly with those coworkers of yours is also very, very like important, because there might be those emergency situations. And I have had a couple of those, but I do also have catheters in my desk, and yes, my TAs go through the desk. Well, yeah, they know about it. I mean, I can't hide it. This is something that's necessary. Have I put it in boxes? Yes. But, just to be able to have it in the drawer and leave makes it so much easier. So if you can, be open with your coworkers. If you can't, I totally understand that. But that also helped in the last, I think, 3 or 4 years for myself to just make it easier for me to say, you know what, I got to go so many times a day, and it's not, on purpose, not because I don't want to be in the classroom. So it's just being mindful of, if you need to tell someone, maybe you really should,
Question, especially for the older members, I'm 46.
We can hear it.
Yeah, we can kind of hear you.
Hear it.
I can project.
Oh, there we go.
There it goes.
There I am.
Whoa.
Whoa, sorry. So my question, I'm in my mid 40s myself. And so especially for a couple of the older people up there, we're all getting older, and there's kind of the sense that we're all a little bit jerry-rigged, and like, do you find that things are coming, you're getting complications as you get older? And if so, we've had this whole discussion over the past day about, finding a urologist and like who can take care of you if something goes wrong and all of that stuff. So like, what experience have you guys had with that?
So I think for me, the most important thing is, I get older, to your point, yeah, certain things don't work like they did in their 20s and 30s, which I greatly miss. And there are complications that come about as you get older. I think it's just really understanding what you have and really being a self-advocate. And I heard a lot about that today, and I can't stress that enough. I think that's one of the greatest things that my parents really instilled in me, and as a very, very little kid in the hospital, is being able to say what was wrong in an articulate way so doctors knew what I was talking about, and not being afraid to say, this doesn't feel right. I don't want to do this. Why does this hurt? Like, I feel full, I need to pee now, I can't pee, something doesn't feel, it's being able to really be that self-advocate. And that's something that has kind of continued in my life up until this point, is really knowing what to say, how to say it, when to say it.
For me, it's kind of, I have not had any major complications, but it's mostly now trying to transition to find that doctor. So you're going to have to kind of play that game of, you're going to have to meet with multiple doctors, and then you're going to have to, go through it. Who's going to benefit me? Who's going to not? What's going to work? What's going to not? The distance is another issue. I know we had talked about that before. So it's just, and like I said, I can't piggyback on the self-advocacy. That's huge, so.
With doctors, I mean, I found myself interviewing at least 3 or 4 before I picked the one I picked. And even then, I mean, I've talked to doctors here, you know, when my doctor wanted to do a procedure, I was like, well, wait a minute, let me see what other options there possibly are.
Mm.
And I would look around to see, okay, well, he said this based on what I have, this could be the best alternative. But let me see what else is out there. Let me get a second opinion. Let me get a third opinion. You know, it's research based.
I think that's what most people don't realize, that you can interview doctors just like you
Mm-hmm.
can interview anybody else. And I think it's important.
Yeah.
I think if you've got minor things going on, it's not so important. If you have potentially major things going on, I think it's important to interview at least two,
Mhm.
maybe more. There's a question up here, Doctor. Oh,
Sure.
I don't break the machinery. Oh, he's got a microphone.
One question I would have, so you're talking to a room full of parents. We have a 10-year-old little girl that's going through the same. And what advice would you give to parents having now grown up and said, hey, this is something that was really good my parents did. This is something that I wish they did different. What would you tell parents of little ones now based on your experience?
For me, I think the biggest thing is don't have her grow up thinking like something's wrong with her. Like I have a twin sister. I did everything that she did. I played softball like a lot throughout my life. And I had no issues. I felt like I was like everyone else. So just try to like empower her and just let her know like nothing's wrong, like everything's normal. Like we just have to deal through things and she'll be okay.
And just to kind of add on that, like that's kind of the same answer that I was going to give. Growing up in my family, you know, I had a lot of complications, as many of you in this room have had, you know, early on. But once I got like a little bit older and stuff like that, it was never that conversation of like, oh, you're disabled or there's something wrong with you or anything, or putting any like you're sick or whatever these labels are. It was more of just like, yeah, you have this thing that you have to manage and that's about it. And, you know, most of the time, you know, years would go by after, you know, I've had my big surgery and I didn't have any complications, and it would be like, oh yeah, I forgot you even have bladder exstrophy, you know? So it's, you know, just trying that sense of, you know, feeling a little bit normal, like, you know, especially if you have siblings and stuff like that. Cause I think, you know, even with her, with a twin sister and stuff like that, you know, you tend to compare amongst each other and stuff. And I think, you know, comparison is kind of a dangerous road to go down.
I had a normal childhood, if you want to call it that. My siblings, bladder exstrophy was never a major thing in the house. It was never, you know, I was never pinpointed of, you know, they kept it separate. It was just normal. My biggest thing is teach her to advocate for herself as soon as possible. She knows her body best. And I think my parents probably wish they could have done that a lot earlier for myself. And I think no matter the age, she knows what hurts, she knows what's going on, and she knows her body best. That's the thing for me.
Kind of piggybacking off that, I think with exstrophy, there's a lot of big decisions. We've talked today about all the different options for surgeries, if you should or shouldn't do things. I think including your kids in that discussion is very important, because a lot of those surgeries you can't reverse, to be honest. And making sure that you're making the right decision, not just for their current state, but them 20 years in the future when they're our ages. I mean, you have to think things in the long run, especially maybe something's going to make something better for now, but is it going to help in 10 years? Those are the kinds of conversations you need to have with your kids too.
And I fully agree with that, because I think once they get to an age where it's at least you can start understanding what's happening with your body. I think when you're younger and stuff, you know, decisions kind of have to be made for the baby and things like that. But I think once they get to an age where you at least can explain to them what's going on and there's some sort of recognition there, I think leaving the choice up to the kid or up to, you know, the teenager or whatever age it's going to be. Like I had a massive Mitrofanoff surgery, and it was one of the best things I ever did. And it was my decision that, you know, my parents allowed me that time to let me make that decision when I was ready. So I think there's something to be said about that.
Yeah, and I would say too, like, be open with her, like allow her to be open with you. I shut it down, shut it out. My parents want to talk about it, I would just I'd push them aside. So I wasn't like able to kind of understand a lot of things, which kind of caused a lot more problems. Like as I got older, like what's happening? Why is this kind of the way it is? Whatever. So be open as much as you can. Let her be open as much as she can with you guys, and like just kind of have those conversations of like what's going on, why it's happening, you know, what to expect, and as she said too, like what are the options moving forward as well? Because like I said, if you don't, it can kind of cause problems and just like confusion as you get older.
I agree with everything they said. I have nothing to add.
Ditto.
There is one point I'll bring up. I know one boy who basically his parents let him make the decision, and he was incontinent, and they wanted to make a decision about anti-incontinence surgery. So he decided at age 8, he'd put it off until he was 9. At 9, he put it off till he was 12. At 12, he put it off till he was 18. And 18, he put it off. Well, he's in his mid-30s now. He's still completely incontinent, totally incontinent. He's never had a relationship with anyone. And it's been a huge barrier to his life. And he's still saying he's going to decide next year whether he's going to have anti-incontinence surgery. So there's times when you need help in those kinds of situations. You need help from someone else who can try to figure out what's going on with the child in that case.
Okay, it's this on. Okay, it's on. Thank you everybody for enduring the stroller squad back here today, making all the noise. They all jumped ship except for me, but and also thank you to the panelists. All 3 of our families met a bunch of you last year. We're so glad you're here, and all the parents who brought your kids, especially having small children and seeing all of you. I don't want to cry. I did enough when George was talking. It's just really nice to be in a room with all these other people, you know? And on that note, where you're talking about like the trauma or making decisions and not wanting to talk to your parents, did any of you engage in any kind of therapy to deal with this? And if you didn't, do you think you would have benefited as a child to do that?
Yeah, I think that's a great point to bring up. And I mean, I just saw the statistic today where it said like it was like 30-something% of, you know, some of the BE patients have experienced depression and stuff. And I remember I say that Mitrofanov surgery that I had was one of the best things that I've ever had. But following that time, you know, I had a lot of like bladder infections after following, and it took almost like a year or 2 of recovery to finally kind of fully recover and get back to my normal self. And during that time, I did fall into like a very like deep depression, and I was like having a really hard time and didn't know, you know, what my next step was going to be. And I did enroll in therapy, and I did, you know, talk with somebody, and it wasn't even anything super serious. It was just like we would play games and have, you know, it's just a conversation at least, and just somebody to listen to. And that was something that benefited me a lot. And then I do remember when I went to youth rally my first year, that was like a concern of mine was, you know, the mental health piece. And I remember that youth rally set up me with a couple of counselors to go and talk to and just kind of have that open conversation with who have like also had the same experience. And I think that's why I like the sense of community that we're trying to build here, because I think, you know, you can go and see a therapist or go see anybody like that. And, you know, it is great, but I feel like the best benefit or the best like results that I saw was talking to somebody who had a similar experience to me, so that I could feel at least validated in how I felt.
Yeah, if I could do it all over again, I would certainly be more open to conversations about it, like try to understand it a lot more versus like shutting it down, kind of like avoid it almost. As I mentioned, like it doesn't go away, it just comes up later on, almost worse. So it wouldn't even have to be therapy. It could just be like finding a group of people like this who kind of have it, or just who are understanding of, you know, you, and kind of want to like understand what you're, just have a conversation, whatever. So like, again, it doesn't have to be therapy, it doesn't have to be something like this. It could just be like a tight-knit group of friends, family, teachers, whoever, but just like find someone you feel, like I said earlier, like comfortable enough to talk to, and just be like, this is what's going on, and be open about it. Yeah.
So for me, I might be the outlier in this. My parents made me go to therapy. I remember when I was very young, and I was almost annoyed by the fact that I was going, because I wanted to go out and play with my friends. It almost made me feel even more different, because now I'm being pulled away, not just for all these doctor's appointments, but now to go to talk to somebody and play games. I don't want to play games with some, 80-year-old man in his office. I want to go out and hang out with my friends. And so for me, like, I didn't see the benefit. Like, I always felt very comfortable in my skin, so maybe I'm lucky about like that. But I just felt it made me feel even more different.
My therapy was, and Rose, was the support group, was the kids breakouts where we go and get to play and just be kids, with other kids that have extra fee. And because generationally, my parents now say to me all the time, like, oh my God, I wish I could have sent you to therapy. You would have benefited, blah, blah, blah. But it is what it is. But for me, it's just simply the support group sessions twice. It was more than twice a year at that point, but those times were amazing for me. And that really helped me because then I connected with other people, those girls, and we would, do email and stuff like that just to connect. That I feel like was that, peace of mind for myself that helped.
I'm definitely going to echo that. This might turn into a promo for the support groups, but I also, growing up, I went every year to every support group, but also my entire family went. And I think the big thing that the support group is incredible for patients, but also I think it's more important maybe for parents and siblings. I think siblings also aren't talked enough about because I have an older brother that I'm very close to. And so I personally didn't go to therapy, but I was very close to him and very close to my parents. So I think it also depends on the nature of your relationship too, if you're open to talking to your parents about that. I was the person that didn't talk to my friends about it, but I told my parents and brother everything, probably too much. But because of that, I think as long as you have people that you're willing to talk to, whether that's a support group, whether it's your parents, you just need some outlet to get those emotions out, to get those thoughts out.
I'm getting eyeballed by my child. I have a 13-year-old daughter. Also, she actually attended a few of those support groups and got to hang out with kids, and she kind of got to understand. So that's another thing to think about.
I'm gonna go along with everyone saying I think the support groups are great. I think youth rally was one of the best things for me too. I only went 3 years, but I met this guy and then we still.
That's cheating.
But we still talk to people that we met from there to this day. And I don't know, the last time we went was quite a few years ago. So it's a great way to meet people. And I think that was the best outlet for me, was talking to people who understood.
And I don't mean to totally throw shade on therapy at all, but again, I grew up at in the early 80s when there wasn't all of these resources. And I feel like we are all so blessed that there is an opportunity for us all to come together and talk like this. This is amazing. There wasn't this for my family and for me. So it was kind of one of those things where you just kind of bucked up and just kind of went along with life. So I think this is great. And I think if there was youth rally and there were more things like this, I guarantee my parents would be here and I would have been here too.
So it's really very individual. And I think it's important to point out that rather than starting your child in therapy, I think you're going to have a social worker or a psychologist associated with your surgical team. Hopefully you do. And I think it's important periodically to have an evaluation to see if anything else is needed, to see how the child is doing. It's important because if you look at 12 to 19-year-olds in a number of double-blind controlled, placebo-controlled clinical trials looking at major depression in 12 to 19-year-olds, picking absolutely, what do I want to say, mentally healthy controls, kids who had no history of mental health conditions as the controls, while the other kids were getting treated. 20% of the control group, the so-called normal group, developed a major depression somewhere between 12 and 19 years of age. And after those were pre-pandemic studies. Since the pandemic, those numbers are quite a bit higher. So I think it's important that you let the psychologist or the social worker on your team evaluate your child periodically just to make sure that everything is going okay, rather than just introducing somebody to therapy willy-nilly, because I don't think everybody needs therapy. Some people do quite well without it. Any other questions? Do you guys have any questions? You people, I'm sorry. I'm from California. You say guys to everybody. Do you people have any questions that you want to ask each other or ask the audience?
I don't think so.
I'm good.
Yeah, I think the support group is really important. They've all said that, and I would reiterate that. Well, all right. I think, thank you very much to the panel and thank you very much to the audience.
Thank you, guys.